What blood tests diagnose stroke? Imagine trying to solve a complex puzzle where no single piece tells the whole story. That's similar to diagnosing a stroke. While imaging tests like CORT scans and MRIs are the main tools, blood tests play a vital supporting role. They help doctors understand what's happening inside the body, identify risk factors, and guide treatment decisions. But it's important to remember that no blood test can definitively say someone has had a stroke. Instead, they provide clues that, combined with clinical exams and imaging, help from the full picture. One of the first blood tests often ordered is the complete blood count. This test measures red blood cells, white blood cells, and platelets. Platelets are tiny cells that help blood clot, so if the count is too high or too low, it can influence stroke risk or the chance of bleeding complications. Next, coagulation tests like prothrombin time and partial thromboplastin time check how quickly blood clots form. These are especially important if a patient is on blood thinners or if a clotting disorder is suspected. They help determine if the blood is clotting too fast or too slow, which can contribute to stroke risk or affect treatment choices. Blood sugar levels are also checked immediately because both high and low blood sugar can mimic stroke symptoms or worsen brain injury. If blood sugar is too high, it can cause confusion or weakness, making diagnosis tricky. Conversely, very low blood sugar can produce similar symptoms. Electrolytes and kidney function tests are part of the routine assessment too. They give insight into the body's overall metabolic state and organ health, which can influence how a patient responds to stroke treatment. Doctors also look at blood lipids and cholesterol levels to evaluate vascular risk factors. Elevated cholesterol can contribute to artery blockages over time, increasing the chance of ischemic strokes. Sometimes, tests for markers of inflammation, like C-reactive protein or cardiac enzymes, are done. These can help identify underlying conditions such as infections or heart problems that might be related to the stroke. Researchers are exploring specialized biomarkers, certain proteins or antibodies in the blood, that could someday help diagnose strokes more quickly and accurately. However, these are still in the research phase and are not part of routine clinical practice because they lack the necessary specificity and validation. In real-world stroke diagnosis, blood tests are used alongside neurological exams and crucial imaging studies like computed tomography scans or magnetic resonance imaging. Imaging is essential to confirm whether the stroke is caused by a blockage or bleeding. Blood tests help reveal underlying causes, such as clotting issues, infections, or metabolic imbalances, and guide immediate and long-term treatment plans. So, while blood tests are invaluable for providing a comprehensive view of a patient's health and stroke risk factors, they do not diagnose stroke on their own. The combination of clinical assessment, brain imaging, and blood work gives healthcare providers the best chance to quickly and accurately diagnose and treat stroke. If you or someone you know shows signs of a stroke, seeking urgent medical attention is critical. Always consult healthcare professionals for personalized advice and care.